Hello everyone, my name is Gloria Rosecil. I'm a student from NCMA, Nurse Caregiver Management Alliance in Malaysia. Batch 8, Extension 2021. Today, I gonna show you the position when feeding. Cutaneous endoscopic gastrostomy. A pig tube is a tube that plays through the abdominal wall into the stomach. It's needed if you have a trouble swallowing or unable to get enough food through your mouth. Supplies together. Correct tube feeding to be delivered. Feeding pump. Feeding set, 60 ml syringe, graduated container, 50 ml water. Position when feeding. 1. Prop up in bed or on a couch in a half-sitting position with head rest at least 30 degrees. Option 2. Sitting up in a chair. Never feed while lying flat on bed. To check gastric residual, PEG, feeding only. 1. Connect a syringe to the pig tube. Number 2, gentle draw back to the plunger and syringe to the withdraw stomach content. Number 3, read the amount in the syringe. Number 4, inject the content back into feeding tube in contact when feeding. Wash your hands, wear apron and gloves. Make sure the position of the patient sitting upright. Measure the desired length of NGT tube to be inserted. Tip of the nose to air lobe. Measure to 5 cm below the septum. Lubricate the tape of the NGT tube. Gentle insert the NGT tube into the nostril. Ask the patient to swallow a small sip of water as you advance an NGT tube. Inspect the patient's mouth to ensure the NGT tube isn't cooling. Secure the NGT tube. Attempt to inspect gastric content to assess the pH. Close the NGT tube cork. Dispose of used equipment into the clinical waistband. Wash your hands. Inform the patient that the procedure is over. Okay. Thanks for listening.
Hello everyone, I'm juvy Ann Flores, a student trainee of NCMA or Nurse Caregiver Management Alliance here in Malaysia, Batch 8 Extension 2021. Today, I'm gonna show you how to feed a patient using NGT feeding or nasogastric tube feeding. Let's start. Nasogastric tube feeding is a special tube inserted through the nose for delivering oral nutrition supplements and medication into the stomach. You are required to feed the patient based on the feeding schedule. Please take note of the time, type of oral nutrition supplement, and amount needed. Feeding steps. Wash your hands. Prop the patient up. Check the feeding tube placement. Feeding of oral nutrition on supplement. Feeding of medication. General precautions when to seek help. You will prepare the following: oral supplement as prescribed, 50 ml syringe, a jug of water, pH strips, a plastic container, 2 small cups, a measuring tape. NGT feeding step by step. Step 1. Wash your hands with soap and water. How are you? How's your feeling for today? Did you feel any pain, weakness, or dizziness? No, that's great. By the way, I am Ann Flores, or you can call me Ann. I am your personal assistance caregiver for today. Today, I am the one helping you to give you your food supplement. Is it okay to you? Alright, that's great. So shall I start? Screen the area for the privacy of a patient. Step 2. Prop the patient up to 30 to 45 degrees. Step 3. Ask the patient to open her mouth and check the back of the throat. This is to make sure that the tube is not coiled. Ensure the recommended external length of the feeding tube is measured and consistent during each feed. The feeding tube should be secured firmly to the nose and cheek with a tape. To check if the feeding tube is in the stomach, withdraw some gastric content with the syringe. If you are unable to obtain gastric content, lie down the patient on their left side, inject 10 to 20 ml of air into the tube, and make another attempt to withdraw gastric content. If you're still unable to obtain gastric content, please wait for 15 to 30 minutes and try again. Read gastric content pH level. If the pH level is below or equal to 5, she is ready to be fed. Please note that the pH level can be affected by certain medications such as proton pump inhibitors, H2 antagonists, and antacids. If the patient is on other medication, please check with your doctor or pharmacist as they might also influence the pH result. Feeding of oral nutrition supplement. Check the feeding schedule. Prepare the correct amount and oral nutrition supplement prescribed. Prevent air entry into the stomach by kinking feeding tube before connecting the syringe. Flush the tube with 20 ml of water or as per prescribed. Feed according to the feeding schedule. Position syringe slightly above the head. Ensure the syringe is not empty during feeding. This is to minimize stomach discomfort due to excessive air entry. Complete the feeding by flushing 20 ml of water or as per prescribed, and close the feeding port with a stopper. Feeding medication. Ensure right medication is being prepared. Crush the medication finely or dissolve the pills in lukewarm water. Connect the syringe without the plunger to the kink feeding tube. Before feeding the medication, flush the feeding tube with 20 ml of water or as per prescribed. Pour medication into the syringe. After administering the medication, remember to flush the feeding tube with 20 ml of water or as per prescribed. The patient should remain seated for at least 1 hour to prevent gastric reflux. Precautions: do not mix medication with oral nutrition supplement. Administer feeds prescribed by your healthcare professionals. Consult nutrition nurse specialists for other options. Use only water-filled syringe and apply pressure to plunger to flush and unblock the tube. Seek treatment or help. Fever of 38 degrees and above, persistent nausea, vomiting, inability to retain feeds, persistent diarrhea, bloatedness, persistent constipation, severe abdominal pain or cramping. If your loved one experiences any of these symptoms, do seek treatment immediately. If the feeding tube is accidentally removed, contact your healthcare provider during office hours.
Good morning everyone, I'm Rosecil Sobrino, one of the trainees of NCMA 2021 here in Malaysia, Nurse Caregiver Management Alliance. Today, I want to show to you the properly for the nasogastric tube feeding. First, we're gonna check for the frequency of the feeding properly for the patient. We check first the orders for the milk feeding, okay, and then the medication at the same time. Properly the hands before doing the injected feeding. So make sure that no bacteria become inside the feeding now. I'm Rose Sobrino. Today I'm your caregiver to giving to you the NGT feeding, right? Okay. First, I'm gonna put your bed here. Gloves. Okay. Put the indicator for the patient. Okay. Put first like this, ha? Okay. And then I'm gonna do for the indicator. I'm gonna do for the aspiration. We check until if they got up dirty inside the stomach. So we're going for the remove that. I'm going for doing now for aspiration. Okay. Okay. But I need to do for flushing. That's why another is flushing for auntie. Okay. So now next step I do for the milk feeding. Yes, I close first this tube, then I put this one, then I prepare the milk. I'm gonna do for this one for the milk. We make sure if how many the scope were needed auntie. This is assuming only. Okay. Like this one. And then I need to stir the milk. That's why the milk is swollen and liquid. No problem about the indicative feeding. Now like this one. We make sure if how many the level for the auntie. Okay, now I giving the milk now. Auntie, I give you a bed. One. We need to open the cover base and then just fold the tube That's why no air to come inside. And then like this, I feed this until the milk finish. And then after that, we do again the flushing. It becomes how many ml the flushing? Mostly the flushing is the 30 ml. So we do for the flushing 30 ml of water and then continuous only. And then we need to do for the, and after flushing, I need to cover again. That's why no air comes again inside the in-between tube of feeding. And now I prepare the medication that needed anti. We need to check how many the medication they needed. So this is the medicines. So I need to put her this assuming only. First step, we need to crush the medicines. That's why it becomes the powder. It's easy to swallow. We mix in the water and with only the water. Let's make sure that the medicine is powder like that na. And then when it stirs, to make sure the medicines is powder, that's so that it cannot problem and with the tube. So now I give this one. This is the medicines from Auntie. Auntie, I give you the medicine now. This is the prescribed the doctor. Every time after you feeding, we need to give you the medicine. Okay. So I give the medication for now. Okay. And then after that, I need again the flush. That to make sure the tube is clean. Flush only 10 ml of water. Okay. And then after that, done for the tube feeding. So I need to clean everything that I do. This one I need to remove. This absorbing only. This one with the gloves. Need to clean everything. So now I done already. And then this is the way that I indicate only how to know handle the nasogastric food feeding. Hopefully I give a good idea giving the auntie the nasogastric feed feeding. Thank you, and this is I apply only what I know to the nasogastric tube feeding. Thank you so much. Following materials I use for the nasogastric tube feeding. This I'm assuming the syringe 60 ml, and then the tube feeding, and then this one the things like the water for the medicines, and then the milk for the feeding for auntie. This is one the medicine, this is the gloves for the need to cover our hands, and then this one the towel for the cover auntie, and this one the documented. Okay, thank you.
Hi, my name is Ailaine ng NCMA Batch 8 Extension. I'm here to discuss about the NGT feeding. Step 1. Wash your hand with the soap and water. Number 2. Rock the patient up to at least 30 degrees. Ask the patient to open her mouth and check the back of the throat. This is to make sure that the tube is not coiled. Ensure the recommended external length of the feeding tube is measured. And consistent during its feed, the feeding tube should be secured firmly to the nose and cheek with a tape. To check if the feeding tube is in the stomach. Withdraw some gastric content with a syringe. If you are unable to obtain gastric content, lie the patient on their left side. Inject 10 to 20 of air into the tube and make another attempt to withdraw gastric content. If you are still unable to obtain gastric content, please wait for 15 to 30 minutes and try again. Step 4. Feeding of oral nutrition supplement. Check the feeding schedule. Prepare the correct amount of the oral nutrition supplement prescribed. Prevent air entry into the stomach and kinking the feeding tube. Before connecting the syringe, flush the tube with 20 ml of water. Or as prescribed. Feed ordinary to the feeding schedule. Position syringe slightly above the head. Ensure the syringe is not empty during feeding. This is to minimize stomach discomfort. Due to excessive air entry, complete the feeding by flushing into 20 ml of water. And close the feeding fork with the stopper. And I thank you.